The United States is currently facing a significant health emergency as a formidable new strain of influenza A, scientifically identified as H3N2 Subclade K, sweeps across the nation. This season is being described by health experts as one of the most severe in decades, with hospitals hitting capacity and mortality rates rising at an alarming pace. In this special report, we break down everything you need to know about the K variant. 1. What is the K variant and why is it so dangerous? Influenza viruses are notorious for their ability to undergo genetic mutations. This specific mutation, first detected in mid-2025, has now become the dominant strain in the U.S. as of January 2026. What makes it a threat? Immune evasion. This variant is highly effective at bypassing existing immunity. Even those who have had the flu recently or have been vaccinated are finding themselves vulnerable. Vaccine mismatch. The 2025-26 seasonal flu shots were not specifically engineered for the K subclade, leading to a higher rate of breakthrough infections. High transmissibility. It spreads significantly faster than previous H3N2 strains, leading to rapid community outbreaks. 2. The current situation, 2026 statistics. According to the latest data from the Centers for Disease Control and Prevention, CDC, the impact of the K variant has been staggering. Total infections. Approximately 7.5 million cases have been reported so far this season. Hospitalizations. Roughly 81,000 Americans have required inpatient care due to severe complications. Mortality. The death toll for the 2025-26 season has reached 3,100, including a heartbreaking 8 pediatric deaths. Hotspots. States like New York, California, Texas, and Florida are reporting the highest levels of transmission. 3. How the virus spreads. The flu is primarily a respiratory illness. The K variant follows the traditional modes of transmission, but with increased efficiency. Airborne droplets spreads through coughing, sneezing, or even talking. Surface contact, touching contaminated surfaces like door handles or smartphones, and then touching the face. Indoor crowding. With colder weather keeping people indoors, the virus circulates more easily in poorly ventilated spaces. 4. Recognizing the symptoms. While similar to the standard flu, symptoms of the K variant tend to be more intense. Watch out for sudden high fever, often exceeding 100.4 degrees Fahrenheit, 38 degrees Celsius. Severe body aches, intense muscle and joint pain, often accompanied by a debilitating headache. Respiratory distress, a persistent dry cough and a severe sore throat. Extreme fatigue, a sudden onset of exhaustion that can last for weeks. Gastrointestinal issues, vomiting or diarrhea, particularly common in children. 5. Recovery and treatment. If you test positive or show symptoms, doctors recommend the following protocol. Antiviral medications. Drugs like oseltamivir, Tamiflu, or baloxavir are most effective if started within 48 hours of symptom onset. Hydration and rest combat the virus by staying hydrated with water, electrolytes, and warm broths. Give your body the rest it needs to recover. Fever management. Use acetaminophen, Tylenol, or ibuprofen, Advil, to manage pain and fever. Note: avoid giving aspirin to children due to the risk of Reye's syndrome. Isolation. To protect your community, stay home for at least 5 to 7 days. You should be fever-free for at least 24 hours without the use of medicine before returning to work or school. 6. Prevention. Staying safe. Mask up. Use N95 or surgical masks in crowded indoor settings or on public transit. Hand hygiene. Frequent hand washing remains one of the most effective defenses. Get vaccinated. Even though the current vaccine is not a perfect match for the K variant, it still provides a critical layer of protection, reducing the risk of severe illness and death by 30 to 40%. Final word. The 2026 influenza pandemic serves as a stark reminder of our vulnerability to evolving viruses. However, through public awareness, early treatment, and responsible hygiene, we can mitigate the impact of this surge. If you experience shortness of breath or chest pain, seek emergency medical attention immediately.